If you could explain a little bit about how Medicaid sort of comes into the fold. I know in my family, we really rely on things like Medicaid and home health workers to have that elder care when we're not able to leave work or provide that care ourselves. So can you talk a little bit about those numbers when it comes to the care economy?
So we have, in some ways, a public option around healthcare. Think of it as Medicaid and Medicare. Medicare is for older Americans, and Medicaid is for low-income, middle-class Americans to help provide for all sorts of healthcare. Okay, to your question. So people like my dad, who don't want to go to a nursing home or an elderly long-term care place, but wants to stay in his home, he's 88. So he has the option of getting someone to come in, say 40 hours a week, to help provide care for him. Medicaid comes in because it helps pay for his care. And he lives in a red state. So lots of red states don't accept part of what we call the Affordable Care Act, or what everybody knows as Obamacare. There was this idea that we could expand it to states, and there was more money on the table. There are a lot of places. So if you live in the South, chances are you don't have access to the same Medicare that if you live in New York or Illinois, where I'm from. You don't have access to those resources because of a political decision by elected leaders in those places. So frankly, people are going into debt, or they're not going to work and missing out on making a living because they're providing care work that they can't afford, or because they don't have access to Medicaid in some places that would pay for that elder care.